Welcome, Judy Simon, to the Dish with Dina podcast. It's such a pleasure to have you join me today.
Thank you so much for inviting me. I've really enjoyed your podcast and the range of guests that you've had and topics. So I'm just flattered to be a guest today.
That means so much to me. And of course, I have an affinity to my colleagues, my dietitian colleagues, and you are one of them. So I would love to learn and have you share with our audience a little bit about some of the origins of how you got even into this profession. And then we'll talk a little bit more about your specialty.
Oh, thanks. So I've been a dietitian for a while, hence the gray hair, silver hair. And I feel like I had part one and part two of my career. And I kind of went through the traditional training years ago. I worked in different hospitals, and my pull was always to the outpatient or the teaching side. I wasn't really so excited about the tube feeding and that kind of stuff. That just wasn't my pull. And as my career moved and I moved along with my husband before we had kids, I went back to graduate school, got my master's in community health education. I really wanted to learn more about why did people make the choices? Why couldn't we just get them information? What was that disconnect that I feel like I didn't get as an undergrad? So I love my master's degree. I got to work in student health at the University of Illinois, which was so rewarding. The eating disorder world was just starting to take off. Teaching students, working with a really amazing staff. So that was great. Got thrown back into clinical again with another move. But meanwhile, in the background, I was happily married, had this master's degree. I really wanted to start a family, Dina. I really wanted a family, and it wasn't happening. And I was this healthy young woman. Fertility medicine is a lot more advanced. So I had my own little background agenda of, I want to have a baby by 30. Well, it was 33 before I had one. So when I finally did conceive and I had some help with the fertility world, we made a change. We moved to the Pacific Northwest, best move ever, lived in Seattle 31 years. And I did get a second kid, which was a benefit. And I took a career change, just like you did, how you've kind of reinvented yourself, not quite as much. And in the second phase of my career, when I did come back, I said, I'm only going to do jobs I want to do. I don't have to work somewhere. I'm going to really be selective. Was so fortunate to be hired by the University of Washington, where I was working in family medicine, and I loved it because I got to teach residents, teach interns, work with amazing patients, and it was fabulous. It was everything I could want. But I kind of had a crabby boss who gave me like a really average performance review. And I'm like, you don't even know what I do. I'm starting my own practice. So fast forward about 18 years ago, I opened up the doors of Mind Body Nutrition. And I said, I'm going to see the patients I want to see. I wanted to work with fertility patients because that would have become my niche. And I still had a strong affinity for working in the eating disorder world and the intersection. So really, as I was talking to you before, is I had to join the fertility world because there weren't fertility dietitians 20 years ago, like a handful of dietitians.
Part of what I love so much about our profession being in dietetics is a lot of us do go in it because we had personal experiences of
Mhm,
our own, and we want to be that representation, or we want to bring our story and hope to support. And like you said, I love the word educate. I love educating like you. I
mhm,
also work in a college, or I work in a higher education area
mhm,
too. And there are things that I think, not that everybody has to have a personal story in order to go into
mhm.
their profession, but
Agreed,
right,
agreed.
but it really does help solidify that. And especially if, we'll talk a little bit too, maybe about self-disclosure if that comes up as well, because there's some
Mm,
sensitivity around the reproductive health and also eating disorder community where we might not want to divulge. But I think we have that ability to be compassionate towards people when we know that we have gone through some things. So let's flash forward a little bit then,
mhm.
Judy, to a current, maybe typical or not so typical week in the life of you. What is your target population? Who are you seeing most often? And share with us a little bit about how that works since you're kind of wearing a few different hats.
I'm wearing a lot of different hats, and sometimes I have to remember what day it is, right? So the first half of the week, I'm in my private practice, like I am today, and really, my panel is really almost exclusively men and women who are trying to build families. So fertility and the realm, the whole breadth of reproductive health. So I do see a lot of women with polycystic ovarian syndrome, and a lot of them management. They're not their family building may not even be on their schedule. I see some women with menopause, and a lot of my patients are actively going through what we call assisted reproductive technology. They're going through, they've tried for a year or two, they're working with a fertility clinic, and most often they were referred to me locally. Most of them are, I've had relationships with the fertility community here. So they'll just say, I want you to see Judy Simon, because they know that I know the fertility world. And when a patient calls me up and they rattle off their AMH, how old they are, how many frozen embryos they have, their eggs, I know all that. I can get right down into the depth. And that's because about 20 years ago, I got very involved in American Society of Reproductive Medicine. One of the few dietitians. I was in charge of I was the chair of the nutrition sub-interest group. But going back to my week, so a real typical week is seeing a lot of those types of clients. Today, I did a podcast. I did a Rune interview for like a women's health, a video great group and app called Rune. And they're asking experts to give video answers on menopause and PCOS. So I did a session with them. I present frequently at conferences. So I'm always working on the next presentation. I'm going to be speaking next at Pacific Coast Reproductive Society on nutrition supplements and fertility. I'm speaking at today's Dietitian on fertility with my colleague Angela Thyre. So there's always things like that. And I teach students in the spring at our GCBD program at University of Washington. I teach nutrition counseling. So I've always got the teaching stuff going, right? And then 3 days a week, I'm on staff at University of Washington, where I mostly see patients, but I also educate. So like last week, I presented a session to our fertility fellows and residents on weight inclusivity and fertility, because there's a lot of weight bias in obstetrics, women's health, and fertility. And they are just so excited to hear there's another way to approach our patients, focusing on health and not their weight. So that's an area of love of mine. And then, I'm promoting that book all the time, Getting to Baby, that my co-author, Angela Thyre, and I, a fertility physician, it just came out last April. And if there's any time left in the day, I try to do as many podcasts as I can, jump on social a little bit, and get the word out there. We did a book signing at American Society of Reproductive Medicine last month, which was a great way to reach fertility providers. So it's busy, and I love it all. And I only have to be as busy as I want to be, as you know, when you have your own business, right? It's as busy as you want to be.
That is sometimes the good and the bad thing about
Yes,
kind of calling the shots here. It's just,
yes.
we get very in the weeds. It's important that we work in and on certain things to remain relevant, and also make sure that we're checking in with ourselves too, which we'll talk about in a bit. So, Judy, as usual, for anybody watching this on the YouTube channel, I'm scribbling fervently as I tend to do, because some of the things I'd like to ask you to follow up on what you just mentioned are more along the lines of the actual credentialing of who we are in the profession, and also advocating for the value of including a dietitian in the interdisciplinary team, or just educating the community that we exist. But let's
Mhm,
first start with the specialties of things, right? A lot of times, because we work with students and interns,
mhm,
et cetera, and
mhm.
myself included, right? You are further along than I am in the profession. But would it be fair to say that, do we ever really feel like we're the experts in something because there are so many things that change? And if there is a way for us to gain confidence, what might be some of the actions that you would encourage people to take that fall either within or outside of the typical scope of practice, things that we have to do, like maintaining our continuing education credits, etc.? So maybe some guidance along of how do we become confident in what it is that we do to be able to speak to our patient population?
That is a wonderful question. Because although I feel like I try to stay on top of everything in reproductive health, my patients still have other medical problems, right? They have rheumatoid arthritis, or they have IBS, So I feel as a dietitian, our scope has to be really broad. Like some people will say, well, I don't specialize in eating disorders. Well, you might not, but you better know how to identify one. You better know how to screen for one. And if you're not comfortable like working in that area, know who to refer to. We can't put a blind eye. So that feels really important to me. But, I think what's important is that we network enough so that we know where are the best places I can get information. Yes, we can go to UpToDate, we can go to PubMed and look up articles, but then we have to talk about those articles because they're not all good. Do you know what I mean? You can't just read an article like, I'm an expert. Like, I was reading someone's slides and she said she did research in the area. I'm like, well, where's your research? Well, you went and read some articles. That's not research. You could say you reviewed the research, you discussed the research, but I think as far as access, how do we become expert? I think a lot of that involves in you have to um, make your own courses. Where do you want to go for your continuing education? Right now, I feel we are so lucky. The good part, the silver lining of COVID, everything going virtual. If you can't go to a conference across the country, you have access often to watch the sessions you want to watch. Like you might not be able to be live in it, but at least you can watch it. And that's a lot better than just looking at slides. So I feel like right now in our field, if you join the groups, like for example, with me, I join a lot of the dietetic practice groups, the ones that have something to offer me in continuing education and discussion. And then I try to, they have so many free webinars. So I try to make sure I leave time because sometimes they're just gems of information, right? So I feel that's important. But I feel on the flip side, when we want to be the expert in an area, we're teaching it to someone else, teaching it to students, offering a webinar, whether we're doing it in social media, because like even doing these Rune interviews, I always have to look stuff up and then I'm like, oh, wow, I didn't know this. So always being a curious learner and being open. So when my patients come in and they share something with me and it honestly sounds like it's off the walls, I go, that's interesting. Where did you learn that? I'm gonna look a little deeper because if we don't keep an open mind, we're going to be left out, and our patients want to know about everything. And sometimes, like you said, we get caught in the weeds. I can listen to what they hear and then ask them, would you like me to help you explore that in what we can offer through food and all? And you might not have to be so concerned about so many supplements because we can get a lot of that from food, like open their curiosity rather than saying, oh my gosh, I can't believe this dimwit. No, it's like work with them like you're really concerned about your health. What do we want to work on together? So I think that always learning, open yourself up to groups you never thought you would listen to, and then use your clinical expertise. And you asked me about so our audience knows as dietitians, we go through a lot of training. We have the minimum of a bachelor's degree. For those of us who are older, now it is mandated to have a master's degree. Our internships, the number of clinical hours went up. We have CE credits. I remind people in a lot of states, nurses don't even have CE requirements. They're done. We have, in some of us are doing certifications, with like diabetes and other areas to increase our expertise and be able to show that we have the competence and the skills. So we really do a lot, and that's why it can be upsetting when someone tells you they went to a nutrition coach and they gave them macros, and I'm like, oh, they went to a 6-week course, and I just tell them we have a more in-depth training and can offer more on the medical side and all too, right?
Yes, I think this brings up a lot of things that sometimes come up in other episodes as well, where we talk
Mhm,
about as the professional
mhm,
to it's fine to specialize and target
mhm,
a niche audience because you
mhm,
might want to represent a particular
mhm,
population, but also, like you said, broaden the information
mhm,
that you're getting. I love joining groups or following on social media behavioral therapists, eating
mhm,
disorder specialists, because, like you said,
mhm,
I'm not qualified in that, but
mhm.
it definitely comes up in conversations.
Absolutely.
I love attending, if I can, clinical conferences or things like right now, right, endocrinology or
Mhm,
GLP-1 is a big thing also.
mhm,
So again, just understanding a little bit more and broadening the language, the skill set, even if I'm not, again, going to specialize in something, but to understand what might come to me. IBS, all of these things, as you mentioned. So I think that's really important. The other thing too, the thing that I noted down here as I was writing a couple of things. So again,
mhm,
to our people who are listening or watching this,
Hmm.
yes, the education is one thing, the counseling is the other thing that what
Hmm.
separates a lot of dietitians from other healthcare professionals. And that's not to say that other healthcare providers might not have some understanding of nutrition, but they are
Hmm.
not as ingrained in it as we are. And Judy, you might agree with me too, especially in your role,
Hmm.
that some healthcare providers can do more harm than good if they do not refer out or they do not say that, hey, I think I need to send you off to someone who can speak on this a little bit more than I can. So you mentioned too about maybe doing like in-service training or workshops
Hmm.
or the community building.
Hmm.
Is there anything that you find most challenging of helping people understand the value of what we do to get us as not competitors, but collaborators in the support of the
Right.
patient?
Well, I find that you mentioned interprofessional education and just being part of the network, being part of the conversation. So, for example, you talk about eating disorders, and one of our attendings came up to me and said, my project right now is to help transition teens to adults. And instead of all the providers saying, well, we don't really know anything about eating disorders, we're going to get our training. Let's figure out what we have. Let's train the providers to understand the medical side. And so they're coming to me for all of this because I've been doing this my whole career. And like, Judy, help, we have to stop saying we don't treat eating disorders. We need to treat all these people. So really, I think having that interprofessional relationship is huge. And the reason I've been going to fertility, professional meetings, and they're talking nutrition, and I'm the only dietitian in the house, is to let them know what we can do and what we can bring. And I think that's so important. And the counseling part is so important. And I think that's where I love teaching the class because I have to keep my skills up. And like, yes, I've been teaching motivational interviewing, but in our program, we're really into eating competence and Ellen Satter. And we've really trained our graduate students with those tools. And that's where I was frustrated when I was first a dietitian because the straight behavioral thing doesn't work. At least it hasn't worked for me. And it's so much more fun when you're not doing all the work, you're working with your clients. And it's funny because even though our graduate program is public health and really focused towards acute, I'm seeing more and more of the students who are like, oh, I want to do counseling and I want to do a private practice. They love the freedom to be able to be more fluid. And I love that our scope of practice has increased. So it used to be you had to be a certified diabetic educator, you couldn't touch all this stuff. Well, now with gestational diabetes, we do it all. We can do the insulin teaching, monitor teaching. I can't make recommendations on medications, but I do communicate with the doc and say, hey, we're seeing this percentage elevated. Do you want to go with insulin? What are we doing next? They prescribe it, but we're so much more involved. I never thought I'd be using, continuous glucose meters and teaching people insulin pens. And virtually, if we used to do like the nurse had to teach them and then we taught them. Now it's like we got this down. And that's where learning how to counsel in virtual health and being able to do both, and there's advantages and disadvantages to both. But I see people from a pretty far distance, and they're like my fertility patients, they have so many appointments anyways. And the fact that they don't have to drive in to see me, or they have the option if they want to. I do both. I do live and virtual in both my jobs. They have advantages for both. They don't get stuck in traffic on virtual. Do you know what I mean? The bridge isn't down or whatever. But a lot of people like, you know what? I'm totally focused when I'm there live. So we didn't have a book, did we, when it went virtual? And the funny thing with getting to baby is for 10 years, I taught these food for fertility classes. I created them. And that's because I saw all these women waiting to get pregnant, waiting for IVF, waiting, waiting, waiting. And with the help of Dr. Thayer, I mean, these were literally in a staff room on a Saturday morning where we cooked, we did yoga, we exercised, all this stuff. It evolved, which is why we wrote the book. And then in the middle of a session, March 2020, what happened? COVID. And I wasn't the best person at using Zoom and cameras and all that, but we took a pause for 2 weeks and then we finished the classes online. I said, okay, ladies, we're cooking in our kitchen. We're going to do what we did in the group. And then we went on for a few more years and did the cooking classes virtually. And the advantages were people could be with their partner, they could be in their kitchen with their knife. And I tried to keep the sense of community, which we lost a little bit live, but we learned that you can go on and you can, because people still wanted to have babies. It didn't matter, it was COVID. Actually, it was the busiest private practice year in my life when the fertility clinic shut down because of, COVID, and we didn't know what to do. They'd be like, "We'll go see the dietitian, go get healthy, go get healthy, go get healthy." So people were baking sourdough bread and painting their kitchens, and I was seeing like a record. I actually burned out that year. It was a lot because we were working on the book too, and it was like, okay, I'm not getting that break except for not commuting. So busy. Just like you, we recreated ourselves, and I actually think it made our lives more interesting on a lot of levels.
This is what I love about us as a
Yeah,
dietetic profession.
yeah.
It sounds, I often say it's not for the faint of heart how many things we juggle, but it really does reflect the investment that we make in our careers. And this
Mm-hmm,
is a conversation that's come up in some of the past seasons where we have people that speak towards career coaching or business development and how we are investing in ourselves and we are
mm-hmm,
also, you can treat something as a job versus a career, right? You can kind of
mm-hmm,
check in, check out, punch in, punch out, and
mm-hmm,
off you go. But also, and for those of you who are listening, who are patients and clients of or
mm-hmm,
trying to manage something, wherever you
mm-hmm,
are in life, and we are too, right, Judy? Like
mm-hmm.
we're humans,
Right.
and I also go to the doctor, but it speaks to the mutually beneficial relationship we have with our patients, and that may or may not be something that you get with, like, your dentist, right? So
Mm-hmm.
we are going through things. We want to form a sense of community. We want to be there to help support everybody, but we also recognize that the people on the receiving end, our patients, our clients, also have to have the resources and the access to certain things. So
Yes.
a lot of what we do is help empower them and
Yes.
provide resources, or like you were just saying, we find ways to pivot and help
Mm-hmm.
them. Okay, it's not a
Mm-hmm.
perfect scenario, but here's how you can still live your life in this new way
Mm-hmm.
of living. So let's talk a little bit about the book, because this is something that is
Thank you.
fascinating to me, especially when so many of us are like, we all have outlets that we'd love to pursue, but who the heck has time in the busy schedules that we do? What were some of the criteria that you had with working with somebody, developing an outline? Like, take us through the process of just
Oh my
how you got
gosh.
it from your brain to page.
Well, I have to say, Angela Thayer, who's my co-author and really the lead author, she's just one of these Renaissance people. So, to be a fertility doctor, you're already double board certified, okay? You're an OBGYN, and then you do a 3-year fellowship, right? Before you can practice, right? So she had all that. She's always loved lifestyle medicine and all. So she was always like kind of hands off, and then got involved. And then she kept saying at first, let's do a cookbook. The women love these recipes. They're changing their life. We would see women who were told they had to lose weight for IVF. In 6 or 7 weeks, I'm not lying, Dina, they started to ovulate when they started to just eat real food, a little bit of exercise, sleep. And it was like, it's amazing. It is amazing what we saw, which is why there's only 9 stories in the book, but we had so many stories we wanted to share. These are real women going through their journeys. So Angela really, she had the writing bug. Okay. So she's the one that she went to writing workshops. And I'll never forget, she was a day I was teaching class. She was at a workshop where you pitched your book, and she found us an agent. I mean, I was like, oh my gosh. So, that it really, she's working full time. I'm working full time. I really had to, I was like, this is overwhelming, but we did it, and it took like maybe a year to write a proposal. Again, we were both working, we beat on weekends and all. And she was really the lead writer. So we'd have these brainstorms, and then she'd write something. And, I look at everything from an eating disorder perspective, and the wording, and it went back and forth. So it took a while, but then we got an agent. And remember, there's like recipes in this book. So you have to have recipes perfect. Just because we used them in class, I'm not a chef. Well, during COVID, Angela took a chef course, like a vegan chef course, like to be a plant-based chef, that she did because she had time. I don't know how she did it. And she also got certified in lifestyle medicine. So we were already doing a lot of it in the class anyways, but we really enhanced, like talking about the sleep and the stress and the endocrine disruptors. So we added all that in, and we said, we're going to take this class, the 6-week class that has been so successful, but we're only helping 12 people at a time. So if we put it in a book, it could be, talking about social determinants of health. It's something somebody could get out of a library. So that's why I'm trying to reach out to the public health people. You have women and, fertility treatment is not mandated, right? If we can help them with lifestyle to get pregnant, with food and relaxation and fitness, I mean, good stuff. So it was a lot. And then, you get a book contract, and if you know how this goes, then they give you a year to write it. And then Ben Bell is like the most amazing independent publishers. And then after a couple months, they read it and you pretty much rewrite the book the next 9 months. So Angela and I spent a lot of Saturdays together, a lot of nighttime sessions on the phone. And you divvy some of it up, and she's definitely the lead writer, but I really did all the nutrition and the recipes and the nutrition part while you're working full time. I felt like it was my capstone of a give back to the profession, to the folks, to the fertility journeys that we took ourselves, that there could be that guide, because we'd go to conferences and they'd be like, what's a really good book? And we're like, we're writing it, we're writing it. Now I can say, we got it, we got it. And it's going to hold steady for a while. And I like that it focuses on food and culinary, like helping people in the kitchen in easy ways, easy skills. So maybe there'll be a part two, maybe there'll be a cookbook, after this, but we're getting the word out on this. And it's a lot of fun, a lot of learning. I am much more comfortable speaking than writing. So this really stretched me, whereas Angela is just a beautiful writer. So I think the two of us together, and then I could take from all the nutrition side of all the patients I've worked with.
As educators, we can agree group projects sometimes don't go so well. So it sounded like you had a really good admiration and respect for each other, and you did focus in on the strength that both of you brought to this. Fun fact, I actually did used to work in publishing, so I know how that process goes.
They're
And so,
amazing people. They're
yeah,
amazing.
so
And
good for you for doing this. I mean, honestly, Judy, whether it's a webinar or
mhm.
an ebook or something really as lengthy as something you did, I really feel like I'd love to take a moment just to encourage people that if you have some ideas brewing, that you want to get something out there, because things don't exist sometimes, or they don't exist in the way that your voice would resonate with the people who need to receive that. And so why not? Why not put something out there that reflects the things that you as a professional have accumulated in however short or long of a time that you've been working on something, that you're collecting stories, you're collecting feedback, you're
Mhm.
improving your own skill set, and then you can send out that information into the world, and who knows who it's going to land into. So this is so fascinating.
I was going to say, I think if I were to do it again, I wish I would have. I always had these ideas for blogs, and I never did them. And I think that's a really good place for people to start. Like I've written articles for, like, professional magazines and journals, but the majority of the time I get interviewed, which is what I like because I love to talk, and I'm really lucky that through the university, I take on a lot of media opportunities. So I've been on, short TV stuff, Northwest Today. I got to do some with the book too. And usually I'm interviewed, but I wish now for the writing, I think a good precursor is getting out the information with blogs and followers and social media. And in fact, what I've heard is that in a lot of our genre of books, that you have to have a pretty decent social media following. And I just never got too hung up. I'm getting more comfortable, mostly on Instagram, and I need to do more in the book. But I think blogging and videos, and one thing I've been attending is the social media summits at the American Society of Reproductive Medicine. And this last one was so fun. It was 4 hours. And these were mostly doctors or healthcare professionals who are busy like me. So I can't say they're not busy, they're busy. And they come in to this room of like 100 of us, and they're so hands-on, like, how do you educate on social media? And they are so much fun. You need this kind of little light, and you need this kind of little tripod, and the next thing. And I thought, well, what a great way. Our patients love short video things from experts. So I think I've answered 92 questions so far, and I'm like, oh, I could start sending those to my patients. So I think there's a lot of ways we can get out to more people, or we can link our patients to more resources. So even women of my age, do not be afraid of Instagram, that there's a lot we can do and reach out to people and educate. And I think the book is a good, is it one really good way? Because a lot of people, I do love books. I love books. And sometimes I'm sick of the screen, but it's also on audio and Kindle. So we have like all three versions. And then I think what I really want to do, I feel like the book is really rich. I really want to get on IG and do more like I want to prepare the recipes and things like that.
I'm telling you, it feels like it's a necessary evil even just to get comfortable with being on social media. And that is a great point to make that, good is better than perfect. So just start doing something. And for those of you who might be concerned about showing your face, there are definitely ways that you can work around that. Like Judy just said, maybe you do, a high level photo or a short video of what you're cooking and you're voicing over that, or you're showing clips
Mm.
of something that's a resource and you are narrating over that. I also love what you said too about the blog stuff. So for myself, that's where I kind of start. I start with very long form information, and then I caption, or I should say, I segment that out
Mhm.
and use one part as a caption, another part I do monthly wellness webinars. So again, I recycle a lot of the information.
Mhm.
I think that's, if people are not entirely sure of where to start, just what do you know? What are you interested in? What are the questions that are coming up?
I think that's a great idea. And I see the creativity of my students. And I'm even thinking about, even in my counseling class, I think I'm going to have them video more things so they can um, like practice telehealth. They could do it with each other on Zoom and practice and talk about some of that. So I think just getting out of our comfort zone and trying new things, we can get information out a lot quicker and we can have credibility out there it used to be like your web page. Now people are like, web pages are not even that, they're not even that relevant anymore. Just kind of who we are a little bit. But I think, having a presence on social media, and being able to share, like if I post something about my book, I tag that to my publisher, I tag it to the co-author, they get it out, and, being able to share, then you trust those people. So I tell people, I go, look at their credentials, look at who they are, find out. And sometimes, even if they have a medical degree, it doesn't mean they're not flaky. It doesn't mean they're trying to sell a lot of stuff that you don't need. But I think that it offers so much opportunity for all of us.
I 100% agree with that. We are not above going into uncomfortable but necessary discussions on this podcast. So I would love to ask you, what currently do you feel is maybe a hot topic that you'd like to clarify, or anything that does come up in some of your sessions over and over again that you're like, oh gosh, this is, a trend or a topic that maybe needs a little bit debunking or clarification?
Recently, again, more people are spending more time on social media, good and bad, TikTok, IG, everything. They are bringing so much misinformation, and really infertility and PCOS. Those are like the women that I see the most. And they're excluding everything, Dina. Everything. So, I had a patient yesterday and we laughed, and I asked if I could share this. And she's someone who's going to go through an IVF transfer, and she had gestational diabetes the first time. This woman you would look at her and you couldn't think of a more in shape body for 41, like blonde, in shape. And so there's that myth that only fat people or inactive people. I'm like, no, it's explaining the science, and she has a genetic history. So she got so much advice. Okay, she goes, well, first of all, my naturopath, because I have hypothyroidism, says no gluten, no dairy, like 5 things because they're inflammatory. Okay, that meant she couldn't have them, right? And then gave her food sensitivity testing. So that took out like another 25 foods. And then a dermatologist told her something. So she had all this information, and she goes, I just want to have a healthy baby. And I said, okay, let's debunk it. Let's go through it. So many people, they're actually leaving out important things they need. They're taking out gluten when they don't have to. So they might be eating an inferior food that's very ultra processed, but it's gluten free. But they could be eating at least gluten free grains that would be healthy, right? So my thing is, let's focus on how you're going to get the nutrients you need. And if somebody's uncomfortable with eating gluten, I'm not going to make them eat it. I'll listen to it and say, if you choose not to have it, that's okay. But not just like this fear of inflammation, the fear of high cortisol levels, the fear of going through perimenopause and menopause, all these reproductive health things. And I really feel, again, with the GLP-1s out there, my gosh, we have doctors now that just say, we'll just give them GLP-1. I was at a fertility abstract session, and our fellow was presenting the data that showed BMIs 30 to 60, the same success rate in IVF. Let's focus on health in that way. And you know what the doctor said? He goes, I just put him on GLP-1s and have him lose weight before then. Like that was his narrow focus because he could get a quick result and not caring about health. So again, those are, you just heard my hot topics: misinformation, weight bias, and not really looking at health versus weight and the damage it can do. And I just spoke on PCOS and GLP-1s, a great webinar panel with two fertility docs, two dietitians. We talked about the pros and the cons. And if you do make that informed decision, have a dietitian help. Have us help them so they don't get sarcopenia. There's some people they are very appropriate for, but there's a lot of people that they're not, and they haven't tried so many other things because food enhances GLP-1 response, right? But we need to be able to teach that. I go, barley, white beans, it enhances berberine, right? So work with a team. So I'm not poo-pooing those. I want to work with those people and say, yeah, get me on your team and let me help you with that.
You are validating quite a lot of things that I've been implementing in my own conversations with my students
Mhm.
when I'm also working with my own patients in the private practice world as well. And also recognizing that it feels to me a little bit irresponsible when there is that approach in the other interdisciplinary teams. Ultimately, yes, please just keep coming back to, okay, do what you're going to do, talk to your professionals, but please at least allow us to support you in that journey because there could be behavioral issues that come up. There could be restricting foods and food groups, as you just mentioned. You know, when you get down to the whittling of here's what's left, I mean,
Yeah,
that might not be satisfying,
it's not
both
sustainable. Right,
calories and
right.
quality stuff. Exactly. It's very, very unfortunate. So you're definitely speaking my language, as I'm sure you probably knew you would, you would be, Judy. I would like to just ask if there was anything that we did not dive into that we have time for to discuss today. Anything that I didn't ask you, anything, words of wisdom, anything left over in our conversation that you'd like to get out before we officially wrap up.
Yeah, well, I just want to say, since you know my love, love, love is for all things fertility and helping build healthy families, that I really encourage folks not to stay in the shadows, to seek out health. Men and women don't realize that their fertility potential doesn't last forever. And waiting till you're 42 to decide, learn more about your bodies because we have more choices. Women can freeze eggs. We can save our eggs if we want to focus on our career and not. Now, it's not 100% insurance, but it gives us some choices. So, and I think it's important to know that your health can play an important role, not only in fertility, time to conception, but your actual pregnancy, because women are older. We're seeing more gestational diabetes, more adverse outcomes of pregnancy. But if we can focus on the health of the person, we can help them to have the best outcome. So that's where in the reproductive world, managing their metabolic health, screening for things like, you know, lipid panels and looking at their hemoglobin A1Cs. There's a lot of people with prediabetes. We can help treat that. Absolutely, with lifestyle and medication with needed. So not waiting if you're delaying your childbearing. So that's just something I really want to bring out. And it's really why I speak to the academy, the dietitians. You have to understand fertility. It doesn't, you know, 40 is not the new 30 when it comes to fertility. People want to think that, but tell your ovaries that they are aging and they are slowing down, and we don't have the magic to stop that.
That is such great guidance, Judy. I wanted to share with you when I first got my job at the OBGYN office. After about a year there, I started attending the provider meeting every month, and I was trying to educate
Mhm.
and learning
Mhm.
more also about what the patients were telling me. Most of the time, I would only get patients sent to me when they failed their glucose test.
Yes,
And so they're like,
yes,
week 33. I'm like, what can I do to help you now? Like, yes, I'll help you manage it, but you should have come to me when you found out you were pregnant or even before when you started thinking
right.
about conceiving. So
Yes.
I had to ask, there were 16 providers and I was there 1 day a week. 16 providers 1 day a week. So I would get whatever I could fit in, and then you'd have to come see me next week or whatever. And the clock's ticking. So I was
There we go. That's
so
why we
peeved.
want people to really
Learn.
look into these things earlier.
Hmm.
Just like we learn about birth control, we need to learn about all of our fertility potential and how we can maintain it, how we can optimize it. And it's big business, but a lot of it could be avoided if we were more aware of our fertility potential at an earlier age.
Judy, my final two questions, my two-part question, my figurative and literal question is what is on your plate today? Meaning, as soon as we wrap up, what's the next thing that you're going to be working on or working with? And then what is your next meal going to be?
I have to prepare for a few new patients I'm going to have today. And then I'm starting to work on our next pop-up, which I'll share on social media. We were hoping to do one in December. I'm going to see if we can pull that up. That means new recipes. My next meal is really interesting because normally I'm such a good packer. And because I had 2 video productions this morning, and I said I want to go to the gym, I ate a good breakfast. I think I'm going to zip home and probably get some leftovers. But I want you to know my dinner, because you're Italian, is I made the best lasagna of my whole life on Sunday. I really took my time and made a sauce from scratch. I used really good quality ingredients. I used fresh mozzarella. I used a good quality ricotta. I put a lot of spinach and vegetables in. I am not nearly Italian, so I did my best. But like, you could eat one small square, and it's like my husband, like, this is like the best lasagna ever. But I'm really obsessed right now. I'm really into all the butternut squashes, creating new recipes. Sheet pan dinner, butternut squash, Brussels sprouts and chicken. And then I did a new soup with roasted butternut squash, roasted onions, and cauliflower pureed with a little coconut milk. So I'm really into the fall foods, but man, I have to tell you, I needed a comfort food this weekend. And now I have lasagna tonight that I'm dreaming of. And then I'm going to freeze it in individual pieces. So whenever I need that delicious comfort food, I'm going to have my lasagna, a winter comfort food for me.
On behalf of all Italians, we're so glad that you
Oh,
consider our
I
food
did okay.
comforting.
Oh, it is. It's so comforting. What could be more comforting than pasta and
That's
cheese?
what I'm saying. Exactly. Love your carbs, Judy. Love your carbs.
Yes, I do.
My dear, it has been a true pleasure getting a chance to know you better and learn more about you, and
Oh,
also having you share so much guidance and information on this episode. So thank you so much for being with
thank
us.
you. And I love listening to your podcast. You're in my queue now to listen. Now that I found out about you. So I love it.
Thank you.